ED is a very prevalent problem with men as they age. ED stands for erectile dysfunction, and generally it can begin as early as the early 40s, but it's more commonly in the 50s, 60s, and 70s. And there's an awful lot of energy that's devoted in our practice to helping guys restore their normal physiology, whether that be with medications or we have some injection therapy. We typically do a testosterone screen, and then if those things don't work to the patient's satisfaction and his partner's satisfaction, then we would proceed on with offering them an implant, which is similar to like having a new hip or a new knee. It's an implant, it's a prosthesis, it's a prosthetic, and it's implanted to restore the physiology of erection. The interesting thing, there are two types. There's a semi-rigid or a malleable prosthesis, which only about 15% of men choose. Most men go with the, quote, Cadillac version, which is the three-piece inflatable prosthesis. And we can put the whole device in through an incision about that long, just at the base of the penis. It takes roughly an hour. And then they're in overnight because they're getting antibiotics. And then they go home relatively pain-free. Obviously they're sore, but they are able to get back to their normal activities within a week or so. And then usually by about 4 weeks, maybe 6 weeks, we're ready to activate the device. Well, we go through a whole process of consent so they understand the risk and the benefits of the procedure and the expectations. That's important. Because you don't want someone to be disappointed, and it's not for everyone. It's just like treatment of prostate disease. You have to select your patient and make sure that you size up their needs and their partner's needs and make sure that they're going to be happy with it. And there are potential risks to the procedure, just like if you had a hip replaced. Things don't always go perfectly, but we stick with the patient to make sure that they get a good outcome, no matter what it takes. Because if they've come this far, they've really invested a lot, and we want them to be basically be able to enjoy the sexual intimacy that they enjoyed, for many, many years and almost took for granted, and then it goes away. And it's like a lot of things as you age, you lose capacity in different areas of your body. So it's nice when we can get a good outcome. Patients, 85% satisfaction rate with penile implants. And the nice thing about a penile implant is once it's in place and they've healed up and it's working, they never have to worry about erectile dysfunction again. They don't have to worry about pills or injections and all that. They're ready to go when they need it.